This is nasotracheal intubation of the adult. Well, first thing we're going to do is check that we do have all of our equipment. We got a good VVM with a mask, and it's attached to high flow O2. It does have a reservoir in place, and we're sitting at 12 to 15 liters per minute. Have our stethoscope readily available. Have an airway adjunct. We're going to use an NPA with this one. Do have a suction unit available with a flexible and a rigid suction catheter. Have our ET tube here already sized. We have our syringe on there, and we've checked the cuff for any leaks. Make sure it's all good. It's all ready to go. Have our capnography or colorimetric device ready to go, and also SpO2, and then a securing device. Want to make sure we have our PPE on, of course. First thing we're going to do is inspect the nostrils, try to see if one is bigger than the other, or if there's less deviation in one of them, or maybe if one of them is obstructed. We want to check all that out. We're going to go ahead and take our NPA here that we've got ready. We've kind of lubricated that distal end, insert it into whichever nostril we feel is larger and it's going to be working better for us. Go ahead and push that down on in there, noting any resistance that we might feel. And then we want to make sure that we do go ahead and begin ventilating the patient, providing good mask seal. We're going to be checking for a good chest rise and fall, and we're going to ventilate at a rate of 10 to 12 breaths per minute. And we can go ahead and put SpO2 reading on the patient and make sure we do have SpO2 preferably greater than 95%. We're going to go ahead and have our partner pre-oxygenate the patient, maintaining that same rate with high flow O2. And we want to go ahead and auscultate breath sounds while they do that, and make sure that we do have proper breath sounds and that there's no obstruction in the airway with that. Go ahead and take our ET tube here, and we've lubricated that distal end. That'll help it pass through the nostrils better. Go ahead and, after we've done pre-oxygenating the patient, go ahead and take that out and take out our NPA. You're going to insert the ET tube down in the nostril, the same nostril, whichever one you deem is bigger. Noting any resistance. If you need to twist it past any resistance, you can do that. Once you see the ET tube in the posterior pharynx, then you're going to begin looking for any misting in the tube and listening for breath sounds right there in the proximal end of that ET tube. Once you do have both those in place, or both those are noted, then you're going to instruct the patient to take a deep breath, and whenever they do inhale deeply, that's when you'll pass that ET tube down through the vocal cords and into the lungs and bronchi. With this mannequin, it is a little difficult to pass through there. It's easier whenever someone's actually breathing, and that whenever they inhale in, it'll open everything up and help it pass right directly into the lungs. Once it is inserted, you're going to go ahead and inflate your cuff. Remove your syringe. You can go ahead and put capnography on the patient, and then begin ventilating the patient. You're going to check for good chest rise and fall. You're going to be looking at your capnography device. Make sure you do have good waveform or colorimetric change. You're going to go ahead and auscultate bilaterally over each lung and also over the epigastric sounds. Make sure that it is absent epigastric sounds. And then you'll want to let your patient oxygenate and ventilate the patient for a little bit. And you can either use a commercial stabilization device if it's designed for nasal, or you can just take a bunch of tape and secure it down, and then also note your depth there so it is good depth. After everything is secured, then you'll re-auscultate lung sounds and make sure nothing's changed, watching your SpO2 reading as well, and noting any signs of hypoxia, cyanosis around the lips or anything like that. And we're going to try to correct that with oxygenation and high flow O2.